at least based upon this one data point, it's safe to say that depending on how you were brushing your teeth at the time of a test, you could see a 10 to 100-fold difference in your Candida. You may be positive or negative solely based upon that. Candida is a normal part, a commensal member of the microbiome of various cavities, right? Oral, vaginal, digestive. So it's held in check by this ecosystem. When, for whatever reason, the ecosystem goes out of balance, that's when the Candida go from commensal to what's known as opportunistic, meaning they see an opportunity to exploit more niches, and they literally dig in or anchor themselves with these hyphae. And that's what you're seeing in this schematic here, where essentially they drop these little anchors, or they form technically what's known as filaments that connect them into tissue. And this does two things: makes them harder to clear, but also those burrowing filaments trigger the immune response, or more of an immune response, so hence more inflammatory symptoms. It wouldn't be any one of these alone, but the more of these that you see or feel or experience, then the more suspicious regarding Candida I would be. Bloating, fatigue, brain fog, or mental fatigue. Brain fog is more of a I can't think straight, and mental fatigue is more so it's just kind of hard for me to think. My brain feels tired. It's a subtle difference, but there it is in case it's helpful. Cravings for carbohydrates. Now, there's a really important distinction here, which is sometimes when people think cravings, they picture, the person is trying to quit smoking and I gotta have a cigarette. But if you finish lunch or dinner and you're saying, I would just like a little something sweet. I'm not ravenous for it, but I'd like a sugary thing, fruit, coconut water, whatever it is. If you don't feel satisfied until you have something starchy or sweet, or let's say you're shopping and they have samples out and you just can't help yourself but have the sample of a cookie or whatever, that in my view should be looked at as a potential warning sign. When your metabolism is healthy, foods like that shouldn't have allure. And as someone who's lived on both sides of this, I can say when I'm doing things right for my gut health and also for my metabolism, I'll give you an example. I was at dinner the other night. I had zero craving for a slice of bread, even though Perry's Steakhouse does have pretty amazing bread that I would often dip in butter and put some salt on it. As I've made some adjustments, I look at that bread with literally zero appeal. So just something to bear in mind. I'm not saying you can't ever have any of these foods, but if you do not feel a neutrality toward these foods, then that could indicate something is amiss metabolically. A few other things would be a white tongue, toenail fungus, recurring vaginal yeast or jock itch, or athlete's foot. If this has been helpful, please subscribe, comment, and if you wouldn't mind, share this with one person you think it would help. The challenge with researching small intestinal fungal overgrowth is you need to do direct sampling from the small intestine, which is quite invasive. And so it's not routinely done, and therefore we don't have a lot of research, and there's not really normative data to guide that, nor is there a test for this routinely available in clinical practice. What is often used is a stool test. And I no longer use nor recommend using stool tests to quantify Candida for three reasons. Firstly, Candida is commonly found in healthy people. I'll give you one evidence point. 2023, just under 700 subjects were examined. They found Candida albicans in the stool of 82.9% of healthy adults. Reason number two, there's no established normal. So you may be saying, well, perhaps there's a way to say, even though most people will have Candida, that some people have too much Candida. This is not the case. We don't have data yet giving us accurate measures or cutoffs to distinguish an overgrown person from a healthy person. It's easy to think because you have a lab test in hand and it says high, that's based upon good evidence. But unfortunately, as it pertains to stool testing for Candida, we don't have good data to tell us, well, this is normal and that's unhealthy or overgrown. And the third is the inconsistency in commercial testing. Here's a split test we performed in office. We had one person pass a bowel movement, put half of their stool in one test kit, the other half in a different lab's test kit. One test found an overgrowth of Candida, another test did not. If one lab is reporting a species overgrown and the other lab is looking at a general Candida screening and not finding an overgrowth in the same person, it illustrates the inconsistency of the commercial stool tests. And these are two of the best tests, in my opinion, in the field, ones that I use routinely for years. And with time, fact-checking, and thinking critically, I can no longer get behind these tests due to this inconsistency. Now, I'll give you one other data point here I found to be fascinating. 2018 observational trial. They took one person and they had them alter how they brushed their teeth. What they had this person do was brush once per day for 2 days, then for 2 days, brush after every meal. Here's their finding. We showed that when a healthy adult volunteer increased the frequency of cleaning of teeth, the abundance of Candida albicans in the stool was lowered 10 to 100 fold. At least based upon this one data point, it's safe to say that depending on how you were brushing your teeth at the time of a test, you could see a 10 to 100 fold difference in your Candida. You may be positive or negative solely based upon that. So for all these reasons, as alluring as the testing can be, I just don't think we have ample data to give us assurances that the results are accurate or reliable. You may have also heard of a blood or urine test. Again, testing I used to use, namely a marker called D-arabinitol, a sugar produced by Candida and excreted in the urine. This is not validated for intestinal Candida overgrowth. And with that in mind, there is a paradigm shift I want to bring you to, which I feel will give you the most effective way to treat Candida as someone who works with people trying to improve their gut health, their food reactivity. Firstly, that symptoms correlate with overgrowth. So we can use your symptoms as a barometer for, have we gotten an overgrowth under control? One evidence point supporting this 2023 review paper, IBS patients, they're having bloating, gas, abdominal pain. Candida levels correlated with the severity of their symptoms, namely bloating and anxiety. So we do have data showing that the symptoms and the levels track. Secondly, overgrowth tends to be nonspecific. We do find evidence showing that Candida and bacteria tend to overgrow together. This one 2013 study looked at 150 subjects with unexplainable chronic GI symptoms, abdominal pain, bloating, nausea, diarrhea, and gas. They found Candida overgrowth in the small intestine in 21%, and they found small intestinal bacterial overgrowth in 25%. I think helpful to understand that if you're having symptoms, the ecosystem is probably shifting in part to an overgrowth, and it doesn't really matter, is it Candida or is it SIBO? These are tending to co-occur. And the other factor regarding the paradigm shift is that bacteria regulate fungus. Two quotes here to help you see the evidence behind that statement. The microbiota likely plays a role in controlling C. albicans or Candida albicans growth in the GI tract. A healthy bacterial community may keep Candida and other fungal populations in check. Why this matters, and something I've seen in some people, they get very focused on Candida and they forget about the rest of their intestinal tract. They forget about the 1,000 some odd bacteria and are only focusing on the 200 some odd fungus in the gut. And this is obviously hugely important not to make this oversight, because these bacteria are a pressure that will prevent overgrowth and keep fungus in check. It is true that the preferential fuel for Candida is sugar, but Candida can also survive off of amino acids if glucose is not available. And my thinking here is diet quality is probably more important than necessarily going low carb. And what I mean by that is when people reduce ultra-processed foods, they're going to limit sugars Yes, but also other foods that have emulsifiers and can stimulate the immune system and are otherwise not conducive to health. And because of that, people may say, well, then you can't have any carbohydrates, like let's say rice or fruit. And that might be going too far. Let me make the case here just briefly with two studies. A 1999 clinical trial, 28 healthy volunteers had their stool candida assessed. Then they were placed on a high sugar diet for 4 weeks. And they did not find an impact on candida. Quoting the authors here, a high sugar diet did not increase the frequency of Candida albicans positive samples. This may suggest that sugar is not that big of a deal. However, perhaps the fact that these were healthy subjects meant that they had a healthier immune system that could better counterbalance this. I think it's debatable. Here's the other study I wanted to share, a 2018 clinical trial. And what they did in this study was, amongst other things, but the dietary component had them avoid refined carbs and sweets, high sugar fruits, things like white rice, lentils, white beans, and processed potatoes, processed meats, milk, dairy, and alcohol. And they focused instead on low sugar fruits, vegetables, fish and lean meats, yogurt, artificial sweeteners and stevia, whole grains, cooked whole potatoes as compared to things like potato chips, and brown rice. And this in of itself was enough to have a significant effect on the candida. In fact, if I'm recalling the details here correctly, the diet was more effective than, I believe it was nystatin, a different antifungal medication that was administered. So this is not, I would say, definitionally a low carb or keto diet. The reason why I paint this perspective is there had been a few individuals with which I've worked, and they were clearly underfed from a carb perspective. They weren't sleeping well, they had fatigue, they had thinning hair, and they remarked that they felt better when they consumed things like rice or brown rice, let's say, fruits, but they weren't eating them because they were concerned about candida. And that might be taking the diet a little bit too far. Fungus feed on starches and simple sugars like sugary fruits. So think white rice, white potato, bananas, mangoes. These are not good for fungal types. However, they do well on, again, sort of your lower carb paleo sort of approach where they're eating salads and broccoli and asparagus, berries, but they're wary of things like white rice, white potato, breads, especially white breads, even if they're gluten-free, and higher sugar fruits. The more compromised someone's system is, my view, is the lower carb they should go. Now, what happens in some cases is when going too low carb, people don't sleep well or they have fatigue. Now, part of that might be that they haven't fully adapted to a lower carb diet, meaning they need to replace the carbs with fat. They could be undercaloried or hypocaloric, or they don't have enough electrolytes, or they haven't given themselves that few days to get through the transition. But nevertheless, this is something that I think a clinician can really help give the context of, okay, where does this person fall on the risk spectrum and how low carb should we be trying to get them to go? But if you're doing this on your own, I would try to go as low carb as you can. And this has been amended in an update we recently made to our Candida diet. But knowing that some people have different metabolic needs and may not be able to thrive low carb, we have left open allotment for some of these starchy and sugary fruits. But just bear that in mind that you want to aim for as low as you can go and then use your experience to sort of titrate your level of carb consumption. In many cases, the herbals are antifungal, antiparasitic, and antibacterial, which is why I favor herbs. So enter a 2015 randomized control trial. They gave subjects either 1,500 milligrams of garlic tablets, or they gave them fluconazole. This is for vaginal candida. And they found nearly identical results in the garlic group as compared to the fluconazole group, 60% as compared to 71%. So pretty amazing. Again, seeing another trial showing us that natural agents, whether it be probiotics or in this case, garlic tablets, are about as effective as the antifungal medication fluconazole. Now, routinely what I've used and many in the field will use is a blend of various antimicrobials. So this might include something like oregano, berberine, black walnut, artemisinin, peppermint, uva ursi, caprylic acid. 2023 in vitro study found that 44 different essential oils, think oregano as one example, cinnamon as another, had varying levels of antifungal action. One of the strongest was actually oregano with specific antibiofilm activity. Oregano can be dosed at about 200 to 600 milligrams per day. Garlic, a starting dose of 1,500 milligrams per day. And I did want to also share something newer to us. We did discuss this in a recent podcast, but Horopito, which sells as a brand called Colorex, versus a different antifungal medication. So Horopito is a New Zealand shrub, so an herb, compared to itraconazole. And in this case, they were treating recurrent vaginal candida, 6 months in each treatment group, and then a 6-month follow-up after stopping treatment. They found that at 12 months, so 6 months of treatment, 6-month post-treatment follow-up, very important because of this condition being recurring, they found that the drug, itraconazole, had a 34% success rate, and Horopito, the herb, had a 66% success rate. All of these data points make me feel very good about what we specialize in at the clinic, which is herbal medicines. There's a time and a place for both, but I'm very pleased to see a growing body of clinical trial data or meta-analysis data showing us the effectiveness of probiotics, oregano, garlic, botanicals, and others like Horopito. We have some amazing natural tools to address fungus. So this brings us to treatment step 2, probiotics. 2023 randomized control trial found that for vaginal candida, probiotics were as effective as the antifungal medication fluconazole. In fact, in that conversation with Dr. Satish Rao, his drug of choice for SIFO, small intestinal fungal overgrowth, was fluconazole. So very interesting to see, according to this randomized control trial, that probiotics were as effective as fluconazole. There's other similar data. A 2019 meta-analysis of 8 randomized control trials in patients with oral candida found success with probiotics, whether it was a blend of lactobacillus and bifidobacterium or a Saccharomyces boulardii. And to quote, "We are confident in declaring that probiotics can have a beneficial effect on reducing oral candida counts." So pretty remarkable, the power of probiotics. And I just want to quickly share with you that probiotics do not only have antifungal action, probably obvious, but just to make sure to state it, this 2023 meta-analysis found that probiotics reduce leaky gut as measured by zonulin or by LPS, reduce inflammatory markers, and reduce dysbiosis. This is relevant when we come back to this concept, this paradigm of ecosystem modulation. I feel a probiotic has such merit because of the antifungal, antibacterial, anti-leaky gut, anti-inflammatory, and anti-dysbiosis impact. And this is why I'm so keen on probiotics, because of the pleiotropic effects. They'll positively modulate multiple different facets of your gut. And I'll just put up on the visuals here briefly our meta protocol. We discussed this ad nauseum on other episodes, so I don't want to belabor the point here. But you're essentially looking at anywhere between 2 to 50 billion CFU per day of a probiotic for a trial period of 2 to 3 months. And you can use a blend of lactobacillus and bifidobacterium, or you can use a healthy fungus, Saccharomyces boulardii. Remember that if you have fungus, you can fight fungus with fungus, which is why Saccharomyces boulardii was one of the probiotics found to resolve and treat successfully candida. And then the third type of probiotic is a soil-based probiotic. An elemental diet is a hypoallergenic liquid meal replacement. The most novel component of an elemental diet, in my view, is that it absorbs in the first 2 to 3 feet of the small intestine, remembering that the small intestine is 22 feet. So If your intestine is inflamed, irritated, has overgrowth, if you can give it a rest with an elemental diet, if you can absorb this solution in the first 2 to 3 feet and the remaining 19 feet don't have to work, that can be very regenerative. Now, we don't have really much research at all on the treatment of fungus with an elemental diet. I would be cautious in one population, and that is if you have oral thrush, oral candida, it might be a problem for you because of the maltodextrin in the solution. Outside of that one population, if it's digestive that you're worried about, I've speculated that because the formula absorbs in the first 2 to 3 feet, and we know this leads to reductions in inflammatory bowel disease, reductions in inflammation, improvements in SIBO, it would stand to reason that it would also help fungus. And because of this, I'm really excited to share this study with you that we just came across. It was published in 2019. 61 children with inflammatory bowel disease were given either biologic therapy, immunosuppression, or an elemental diet. After 2 to 4 weeks, they found first and foremost decreased disease activity. But secondly, they found a small but non-significant decrease in Candida levels. I want to be careful again to say this was not significant, but if nothing else, this shows us we can reduce inflammation and disease activity, improve symptoms, without causing any overgrowth in Candida. And this is what we see sort of intonated in a 2017 systematic review. The bowel rest induced by the elemental diet may induce mucosal healing by limiting the activity of potentially pathogenic microbes. So this concept of rest, and this is one of the reasons why I have found, and many people anecdotally have found elemental diets to be so helpful. And there's a lot of research in inflammatory bowel disease showing, again, reduced disease activity and reduced inflammation. As we've been getting more precise in separating bacterial overgrowth from fungal overgrowth and tracking patients in the clinic, we're seeing that die-off appears to be much more common with fungal overgrowth or with Candida. This could include, but it's not limited to, headaches, joint aches, joint pain, fatigue, a worsening of gastrointestinal symptoms. Now, this often will only last a few days, but in some cases may last for a few weeks, especially if you're doing what we generally do in the clinic, which is layering a few different treatments successively. Probiotics first, give that a week, then we'll add garlic, give that a week or two, then perhaps we add horopito. And so you may notice a little bit of this die-off with every successive addition. That's very important because sometimes people will say, oh, I was having a negative reaction, I'm just going to stop. Negative reactions tend to not get better over time. Die-off reactions tend to start within the first, second, or third day, usually, and then by the third, fourth, fifth, or sixth day, they've abated. So keep that in mind. This very likely will happen to some of you who are trying to treat Candida, and it'd be really unfortunate if that scared you away and you didn't have sort of the poise and the paradigm to try to navigate through that cautiously. If you're ever unclear, I think speaking with your healthcare provider who's experienced in this can help take some of the guesswork out of that. And if you're floundering and you need help, please feel free to reach out to the clinic. This is what we love to do, and we'll be more than happy to assist you on your path. Alrighty, guys, this is Dr. Ruscio. Until next time.